Well, the North Carolina Department of Health and Human Services is seeking solutions to what can sometimes be a deadly issue. A pilot program set to get underway soon that would change the handling of mental health patients. Right now, law enforcement handles the process of transporting a patient that was being involuntarily committed. But we've seen that turn dangerous and deadly. In 2022, a woman was shot and killed by a CMPD officer after firing shots at officers who were attempting to serve an involuntary commitment order. But this new program would pass the duties to a trained trauma team to help those already in mental distress. WCNC Charlotte's Miles Harris has more on the impact this new program is set to make.
North Carolina just made a groundbreaking step that could help support individuals experiencing mental health crises. The state's Health and Human Services Department, they just announced a $20 million investment that could transform mental health crisis responses across the state.
For years, law enforcement has been responsible for transporting individuals experiencing mental health emergencies, but that's about to change.
This is a long overdue, policy change.
The new non-law enforcement transportation program aims to provide a more compassionate approach. Instead of police vehicles with sirens and potential handcuffing, patients will now be transported by specialized trauma-informed providers.
We know we're going to feel pain.
Mental health advocate Fonda Bryant stresses it's a step in the right direction.
Police officers should not be handling mental health and suicide addiction calls.
She says the program will help the community better understand a crisis.
The more you know, the more the signs that you recognize that somebody may be in crisis or suicidal or struggling with mental health, and you ask the question, are you all right, are you okay, knowing the resources, the better off people will be, and we won't need police officers to help us.
It's devastating for those who are actually going through a crisis.
Charlotte Fraternal Order of Police President Daniel Redford says police being part of the transports can make a difficult situation more traumatic.
They're already experiencing mental health crisis and stuff like that. And now all of a sudden you got the police showing up with handcuffs on them. And a lot of the times it's hard to distinguish between, them being arrested versus, getting transported to a mental health facility for treatment. So
this $20 million investment is part of a larger $835 million commitment to transform North Carolina's behavioral health system, with goals of building a more responsive crisis network and providing faster access to care.
My goal and my hope is to get rid of that stigma so people will feel comfortable and ready to go get the help, because we can recover and we can live a good life. I mean, look at me 30 years ago, handcuffed, taken to a mental health facility, and look at me now, turning around and helping others and sharing my story.
The new transportation program will initially operate in 2 regions of the state, which will be identified through a competitive request for proposal process. In South Charlotte, Miles Harris, WCNC Charlotte.